Health Equity, Diversity, and Inclusion Committee is a newly created structure that has come together as a result of encouraging advocacy from three main stakeholder groups in our organization, including our Board of Trustees, our medical staff, and our labor partners.
The committee is going to look at several elements of our environment. One, of course, is the culture. Do we have an inclusive culture? And what can we do to make sure that everyone who works here feels like they belong and that they can thrive here? And in addition, we're looking at whether or not patients feel welcomed and patients feel that they, regardless of their background or the language that they speak, that they really feel comfortable getting high quality care here. We're also going to look at whether or not our leadership reflects the diversity of the communities that we serve.
Important reason why Alameda Health System is leaning forward with this effort right now. And that is that while we see a lot of improvement in things like health indicators and inclusion in our workforce for the different communities that we serve, there's still so much more that we have to do. And if we don't do it now, we run the risk of losing the important progress that so many other people have contributed to.
We're going to take a look inward and make sure that we really have a diverse workforce at every level. And second, we're going to look at whether or not that workforce is empowered to provide culturally competent care to the patients that we see. We live in one of the most diverse environments in the country, and we have patients from every corner of the globe. So we know that we need to be very mindful of how we're approaching those patients, making sure that we're providing them the best care and doing it in a way that makes them feel really comfortable, whether it's language issues, cultural preferences, religious preferences, all of those factors are what make culturally competent care.
You know, at the end of the day, as a healthcare delivery organization, our main goal is to create a healthy community. So I have really high hopes for this committee and the work that it will do. I think it has the opportunity to fundamentally change the way in which we advance health equity and diversity and inclusion, all in service to creating a healthy society. So our policies and our practices will reflect truly the needs of our community in ways that enable and empower them to be better agents of their care.
I think that this is a trend that we're seeing across the country right now, and I'm so proud that we will do this here in the Bay Area, where we serve the most diverse population and have the most diverse workforce. I think that it means we are embracing the diversity of our patients and our staff to make sure that we're providing the highest quality of care for all.
And success for us will be when the organization not only reflects the community, but is the community.